clinical psychologist, neuropsychologist, and clinical neuropsychologist. If you are a psychology student, you would have probably come across these three terms. And somewhere deep down, you may have wondered, are these actually different? Or are they just fancy names for the same thing? See, the truth is, most students make their career choices without fully understanding these differences. That's why it's important to break down these three terms in the simplest and most relatable way, so you don't end up making a career decision based on confusion or half knowledge. Let's first start with clinical psychology. A clinical psychologist deals with serious mental health conditions. This includes disorders like depression that affect daily functioning, obsessive compulsive disorders, trauma, personality disorders, severe anxiety, and more. Their work is structured, scientific, and requires proper training. A clinical psychologist does not just sit and listen. They are trained to diagnose mental disorders, use psychological assessments, create structured treatment plans, and provide evidence-based therapies. In India, they often work in hospitals, rehabilitation centers, or private practice, sometimes alongside psychiatrists too. This field requires emotional strength, patience, and a deep understanding of human behavior. So if you are someone who is genuinely interested in mental illnesses, diagnosis, and therapy, this path may be the right fit for you. If you want to know the full roadmap to become a clinical psychologist and its scope, you can watch these videos on this channel. Now let's move to neuropsychology, where the focus shifts to the brain. Here the central question is not just how a person feels, but how their brain is functioning. A neuropsychologist tries to understand how the brain affects behavior, memory, and emotions. For example, someone may have had a head injury and is now unable to focus, or a person may be experiencing memory decline, or a child may be struggling with learning difficulties. In such cases, the question becomes, which part of the brain is responsible for these changes? Neuropsychologists conduct detailed cognitive testing to assess functions like memory, attention, language, and executive functioning. Their work is more technical and assessment focused. They play an important role in diagnosis and planning a base for further treatment. And only therapy is not their primary focus. So if you are more interested in understanding brain functioning, testing, and cognitive science, this direction may suit you better. To gain full clarity on the job roles, qualifications required, salary scale, and scope in this field, you can watch this video. Now let's come to the most misunderstood term, clinical neuropsychologist. It's important to be very clear here because this is where a lot of misinformation exists. A clinical neuropsychologist is not a completely separate starting career option. Actually, it is an advanced specialization. Typically, you first become a trained psychologist, often with a strong base in clinical psychology. After that, you move into neuropsychology through supervised training, PhD, fellowships, and hospital-based exposure. At this level, the role becomes more comprehensive. A clinical neuropsychologist conducts detailed brain behavior assessments, contributes to the diagnosis of neurological conditions, designs cognitive rehabilitation plans, and helps patients adjust emotionally after brain injuries. They usually work in hospitals, neuro-rehabilitation centers, and multidisciplinary teams alongside neurologists and other professionals. The key point students must understand is that not every neuropsychologist is a clinical neuropsychologist, and you cannot directly become one right after graduation. It requires years of specialization and supervised clinical experience. Now let's simplify everything in this video. Clinical psychology forms the foundation where you work with mental disorders and therapy. Neuropsychology is another specialization or maybe further specialization focusing on brain behavior relationships and assessments. Clinical neuropsychology is an advanced stage where you apply both in complex neurological cases. Remember one thing, don't choose a field based on what sounds more impressive or rare. Choose based on what genuinely interests you and which has proper job opportunities. Your career in psychology is not just about choosing the most complicated title. It is about choosing a path you can stay committed to for years. Because the clarity you build today can save you from regret later. Like, share and subscribe for more. Thank you for watching. See you in the next video.